So I want to just give you a little background as we get started this morning on why we decided to do this study. So as folks have touched on, we are doing these community initiatives, and Capacity to Care is one of those initiatives. And Capacity to Care has sort of three main areas of work. The first of which Bobby touched on, which is our caregiver awareness campaign. And that campaign was one strategy. Like Paul said, whenever we're addressing these complex community challenges like supporting caregivers of older adults, we recognize that we're going to need multiple strategies. So the campaign was sort of our first strategy, and it was a strategy that was mainly focused on increasing caregiver self-identification, because we saw that lack of identification as one of the root causes of why caregivers weren't reaching out for support, both from those in their informal networks, their families and friends, but also from formal systems. And so we did the campaign and really sought to increase caregiver self-identification and also just general community awareness, right? That when we thought about the campaign, when we designed the images, and you can see some of them on the bookmarks and things on your tables, we thought about not just targeting current caregivers, but also thinking about how do we increase the awareness of people who are going to be caregivers or the people who are in the families and the networks of those people who are currently caregiving. So the second strategy that we initially had planned is the third thing that's on this slide here, which is community pilot projects. And we decided when we were first starting the initiative, we did some information gathering sessions. We talked with caregivers. We talked with some of you in this room, city and county planners, folks from the MAAA and the Board on Aging. And we sort of asked, Wilder wants to do this work to support caregivers, but what's the unique contribution that we could make? Right, what's the place that something needs to happen that isn't already happening? Because we really wanted to offer something new to the conversation and new to the effort. And what we kept hearing, what kept recurring in those conversations, like I said, both with caregivers and with providers, was the focus on the informal. That there was a lot of effort being put into creating high-quality programs for caregivers, for thinking about how systems could be responsive to caregivers, but that there was this whole other piece, which was that informal piece, right? Families, friends, faith communities, neighborhoods, that sort of wasn't being thought about or impacted as much. And was that a place perhaps that Wilder could put our focus? So we listened to that, and we decided that that would become the focus of the Capacity to Care initiative, would be to strengthen those informal support networks around caregivers. And so then we thought, if we're going to do this, and we're going to try some new things in, like I said, neighborhoods and faith communities, maybe we should gather a little information about, what do those informal networks look like now, and where are the strengths and where are the weaknesses? And so we had our interdisciplinary team, like has been talked about, and we're talking with the folks in Wilder Research, and we think, maybe we shouldn't do this just so it can inform our work. Maybe we should really make this something bigger. And so we sort of went from something that was going to be sort of a little initial information gathering survey that would help inform some pilot projects to developing a full study that you're going to see the results of today. And I'm really excited that we did. So that sort of became our third area of work then, because we've learned, I think, some really great things. And by doing this work in a way where we have generalizable data, it's going to be valuable not only to Wilder and to others in our community, but actually to other communities as well. And I really pushed, as we were doing the work, to keep us focused on this informal piece and to keep asking, what could this study add to the research that already exists, right? There's tons of research out there about caregivers. We could read oodles of information about stress and burden and all of the things. And it's not that that's not important, but I wanted to add something new. I wanted to see if we could contribute something that wasn't already there. So this is our attempt, and you'll get to tell us today if we've succeeded. So in the survey, we talked with 212 caregivers. And I want to thank those folks who, I don't know if is anyone in the room who took the survey? Okay, so we had a gathering on Monday night, actually, for those folks. We invited all the caregivers who participated in the survey to a convening. We had 45 caregivers come, and they had a similar conversation to what we'll be having today. It was a great event. There was a lot of passion and a lot of energy and a lot of ideas, and we'll be kind of intermingling what we heard from them in our presentation today. But really, we owe a lot to them. They spent on average over an hour on the phone with our survey interviewers. And I warned our staff before we started. I said, from my experience, when you get people started talking about their caregiver stories, they keep talking, no one's asking them on a regular basis. So when you get a chance to really dive into thinking about it and talking about it, I said, I don't think the problem is going to be that you're keeping them on the phone. I think the problem might be that they're keeping you on the phone. And that turned out to be very true. And our survey interview staff told me that oftentimes when they would get to the end of an hour-long conversation, right, the caregiver would thank them. Thank you so much for asking these questions. Thank you so much for taking the time to talk with me. So I think it was our survey interview staff loved doing it, and it was a really valuable experience for the caregivers who participated as well. And then I also want to really thank and acknowledge my caregiver advisory group and the volunteer team who has helped me with that support of that team. As Paul mentioned, community engagement and thinking about how we do that all along the way. This caregiver advisory group has been with me since the beginning of this initiative. So they helped brainstorm the initial survey questions. They were the ones who tested the survey instrument once it was put together. They did the first phone interviews. They then looked at the initial results and helped us think about, so what? What does this mean? What are you seeing? What are the connections we want to make? And lastly, they helped us format the report that you have, the summary that you have in front of us, and put together the presentation for Monday night for the caregivers. So they have really been an essential guide and source of advice, and really keeping me focused on how does this resonate with the real experiences of caregivers in the here and now. And then, of course, the folks that have already been mentioned, the caregiver services staff and the Wilder research team, they've been invaluable partners in this effort, and I in particular want to thank Greg and Kirsten because I'm really focused on innovation, and like I said, I'm trying to do things that are new and contributing something unique. And so I kind of kept coming back to them, like 2 weeks ago when I was like, I looked at the draft summary, which you all have in front of you now, and I said, we have to completely redo this. I've got a whole new idea of how we could present this that would make more sense. And they have been so patient with me as I pushed to really get us to the place I wanted to be so that this could be as valuable as possible to all of you.